good afternoon. As of 12:20 this afternoon, we have 436 confirmed COVID-19 cases. 100 of those cases are now hospitalized. We have had 5 deaths, and the age range is 14 days old to 97 years old. And so a little bit about the order that we're putting in place today. The idea is that businesses that remain open because they're considered essential services, we're asking them to develop and implement a daily screening program for employees. That includes asking on a daily basis, what are your symptoms? What kind of close contact you may have had with a confirmed case? Have you traveled internationally or domestically over the last 14 days? We're also asking businesses to develop and implement a plan to manage and control social and physical distancing, at least 6 feet for employees that are working alongside one another, and also customers that may be inside a store or waiting in lines inside a store or outside of a store. So for instance, a grocery store where somebody's waiting to check out, actually laying tape that shows what a 6-foot isolation distance would be so that those individuals can maintain that social distancing. Outside, if you have people waiting to come inside, to reduce maybe the number of people that are in your building, providing tape down so that they know what that 6 foot is. So what we'd like to show you today is how to conduct maybe what your screening program could look for, conduct a screening program at your business, what that might look like. So I'm going to ask Nurse Kate to come up, and we're actually going to conduct a screening program.
Good afternoon. There are many models of thermometers that you can use, but what we're recommending is a no-touch forehead thermometer. It's very simple to use. I'm going to demonstrate with Leanne here how the screening process would work. You would want your screening station to be as close to the front door as possible so that anyone coming into your building would be screened before gaining entry into the building. And the important thing to enforce with your staff members or any visitors coming into the building is that if the screening is positive for any of the questions or for the temperature, they will be asked to go right back to their vehicle. They will not be allowed access to the building. That's very important. So with the no-touch thermometer, or forehead thermometers, excuse me, it's very simple. There's an on button, turn it to scan, and you would maintain your 6-foot distance while you're asking the questions of your visitor coming in. And so, good morning, Leanne. How are you feeling today?
Really great.
Do you have any fever, cough, or shortness of breath?
No, I have not.
Wonderful. Have you come in contact with any confirmed case of COVID-19?
Not that I'm aware of.
Have you traveled at all in the past 14 days?
I have not.
Thank you. I'm just going to check your temperature. It will just take a moment, and we're going to stay about 1 inch away from the forehead. Press the scan button. And that's it. A perfect temperature. Leanne, you are cleared to attend work today. Thank you.
So some simple steps that we're going to require our businesses, our essential businesses, to take for the next 3 weeks under the governor's orders. By the way, I fully would expect that even after that period of time when non-essential businesses start to open, we'll probably see some of these precautionary measures needed then too. So this is just a good thing for all of us to get used to as we go out and about it in our day. The last thing I want to just mention before I open it up for questions is, yesterday we opened up a drop-off center for supplies for anybody who had face masks or gowns or thermometers. And I just want to express my sincere gratitude. We had 10,000 N95 masks from Home Medics donated yesterday, 20,000 surgical masks, 6,000 safety goggles. Our residents and our businesses have stepped up in an incredible way, and I'm so grateful. And this is, I think, the silver lining of the situation that we're in now is just how folks step up and meet the challenge that we face. And if you have any of these essential supplies, we would encourage you to go to the Oakland County Farmers Market, which is up here at the county complex. We'd be happy to receive those supplies and equipment. Thank you. So now, this is a press conference, and I have, I believe, 11 reporters who are with us. I'm going to just call on your name, and then you can unmute your phone by pressing *6. I'll do this one at a time, and if you have a question, feel free to ask it. So maybe we'll start with Mark at the Oakland Press. Mark, any questions? Or just say no.
Hi, Dave. Hi, Leanne. Can you hear me?
Yes.
Great. Do we know how many Oakland County businesses have been deemed non-essential under the governor's order and the total number of workforce impacted?
We don't have those figures yet. In fact, since we're still in the first 24 hours of this, there's a lot of businesses that are trying to decide if they are essential or not. I would just, and that brings up another point, which is if you are a business that is not sure if you're essential or if you are essential or not, you can call us at Oakland County, and I want to give you that number, 248-858-0721, and we're in touch with the state folks, and we can help determine whether you're essential or not. But Mark, we don't have those numbers yet.
Okay. And then a quick question for Leanne. Are hospitals in Oakland County currently at or near capacity in terms of general beds, ICU beds, supplies, looking up there?
So we are working with our hospitals as they have needs with our emergency operation and our healthcare coalitions to determine if they're at capacity and the needs that they have.
Anything else, Mark?
That's it. Thank you.
Thank you. Next, I have Chad at Cranes Detroit Business. Chad, do you have any questions for Leanne or I? I'm going to take that as a no. How about Sarah at the Detroit News? All right. How about Tracy at Michigan Radio? Tracy, are you there?
Remember to press *6.
Yeah, press *6 if you. Oh, hi.
It's Tracy Hamilton, Michigan Radio, sorry.
Yeah, hi Tracy. Thanks for joining us.
Hi. So I wanted to clarify, it sounds like it is part of the order that this screening go on. What about employers who, I want to clarify that, and also what about employers who can't get these thermometers, and what about protecting the person who's in charge of taking the temperature because you have to get really close to that person?
Yes, so we are putting out, there's a fact sheet that will be up on our website right after the press conference. It's probably there now. That will help with screening questions, and it's in lieu of a thermometer. Obviously, that is the best practice. But if you're not able to have a thermometer, you don't have one on hand, there are other questions that you can ask, and just talk through what the symptoms would be.
Well, the other thing she asked about was the employee. So what precautions should they take?
So we actually have a nurse sitting, taking temperatures at the health division as employees are coming in, and she's just made aware of things to watch for, right, for symptoms. She is not suited up in an N95 mask. That's not recommended. She's aware of the precautions she should be taking and staying, a good space, except for just taking that temperature, as Kate just mentioned.
Anything else, Tracy? All right. From MLive, Lauren, are you on with us? Just hit *6 if you are. Right. Ken from WJR. Oh, I'm sorry.
Hi, David. Hi, Leanne.
Whoop, hang on a second. Was that Lauren at MLive?
Yes, it was.
Okay, sorry. Hang on, Ken. We'll get with you in a minute. Lauren, do you have a question for Leanne or I?
Yeah, absolutely. I just had a couple of testing-related questions. I guess in Oakland County, is the increase in numbers at this point, can you attribute that to more testing? And are the people who need testing in Oakland County getting tested, in your opinion?
It certainly is partly responsible for the increased number. We are doing increased testing, especially at our major health centers are doing, and both Beaumont and Henry Ford now have the capability to do testing on site, so that has increased the number of tests going on. But in response to your second part of your question, which is, are we doing enough testing? Not even close. I mean, and that's nationally. We know that one of the ways that we're going to address this epidemic more effectively is to get more people tested. We don't have enough testing kits yet. We don't have enough laboratory capacity to do that. Frankly, there's not even enough swabs and medium and other things to do all the testing. Those numbers are increasing. The amount of tests that we're able to do are increasing daily, but we're still not anywhere near where we need to be in terms of testing our population.
Absolutely. And then one other question, if I may. Are you concerned at all that...
Go ahead, Lauren.
Oh, sorry. Okay, I'm sorry. One other question. Are you concerned at all that these screening tests may allow people who are asymptomatic or not necessarily aware that they have the virus or may have been exposed could get through?
You know, at least we're putting a screening question in place, right? If we're doing this on a daily basis, people are going to start to see if symptoms, may change. Sometimes people don't even realize they have a fever, but if you're taking it on a daily basis, you're going to start to see some of those symptoms change. It might be a change in, a cough or, so we're asking people to do this on a daily basis so you can start to see if there is a change.
Thank you.
Thank you. All right, Ken, you've been patient. Could you ask your question?
Yes, I have, David and Leanne. Thank you. Two quick questions. With essential businesses, are doctors' offices exempt, or are they also under this? Because there's some confusion. We've interviewed two doctors who are out of business. They're laying off people.
So the question is, are doctors' offices exempt? Leanne, do you want to ask?
To me, no. I would think that they would not be exempt, right? We need our physicians out there providing that guidance as necessary. But again, if there's questions, I think they call our office and we can walk through that based on what services they provide.
It may be that they provide primarily elective procedures, and we know that there is an order against doing elective procedures, and so that may be the bulk of their work, and so that may be why they're in that situation. But regular physicians, general practitioners, and the like should remain open.
Final question. How many people are hospitalized because of COVID-19?
In Oakland County, we have 100 confirmed COVID-19 patients that are in the hospital. So the question was, how many people do we have hospitalized because of COVID-19? And that is, we have 100 hospitalizations for those that have a confirmed COVID-19 test.
Is that it, Ken?
That's it.
Thank you, sir. Kim, is it WXYZ? If you hit *6, we can... Yeah. Hi, Kim.
What the penalties are for not following this order?
Well, that's the sheriff. Okay, yes, thank you. So I'm getting the question is, what are the penalties for not following this order? One of the things that if people are not following this order, by the way, is that they should call the sheriff's department and report this. There are misdemeanor penalties and fines. There is enforcement mechanism in place, but as I started out by saying, we really hope that this is helpful guidance to our employers and businesses in Oakland County, and that they want to take these precautionary steps to keep their employees and our residents safe, their visitors safe. And so there are enforcement mechanisms here, and the sheriff, in worst case scenarios, can go out and penalize, fine, and report businesses who do not cooperate, but that's not our focus, at least initially. We believe that most businesses will step up and do the right thing.
And can you talk about how many beds and ventilators are in Oakland County? How many you guys are trying to get in place in a certain time frame?
I don't have those. Oh, I'm sorry. They asked how many beds or ventilators that we have. We're working with the hospitals as they need that. I don't have those statistics in front of me, but we're working. The Emergency Operations Center is open, taking requests, and we also have a healthcare coalition in Oakland County that's working with the hospitals to get that information.
The one thing I would add is the good news is they're actually bringing on additional capacity. I know I talked with the folks at Beaumont yesterday who have converted some of their operating rooms and surgical rooms to ICU centers because they were doing non-elective, elective surgery in those locations. So they're trying to put as many beds into as many spaces as they can to try to increase that capacity. But we're planning for the day when they are no longer able to increase their capacity, and then we're going to be prepared to help them locate patients as necessary. All right. How about Ingrid from Fox 2? Ingrid, are you there? All right. How about Darcy at the Free Press? Darcy, are you with us? Just hit *6 if you are.
Hi, Darcy Rainier. So I just had a clarification, a couple questions. You said that patients range from 14 days old to 97 years old. Can you clarify whether or not we're talking about patients who have died versus,
No, those are, I'm sorry, the question was in the age range of 14 days to 97 years old. Those are patients who have tested positive, not patients who have died.
what can you tell us about 5 patients who have died, you know, their age range, their underlying symptoms, if any existed?
You know, we have that information. We don't have it in our hands right now. We can certainly get you that. I'll make sure that Bill gets you that information.
Thank you.
Okay, thank you. David from the Associated Press, are you with us? Oop. Everyone else should mute your phones, by the way, just so we can hear David.
Yeah, the governor said that Beaumont was almost at capacity. Just wondering how concerned you are about that, and if you had any more information about what that meant, if that's a reference to ICU beds.
Yeah, the question was about Beaumont and them being near capacity, which is they shared and the governor shared this morning. They are getting near capacity, but like I said, I spoke with Beaumont yesterday, and they were adding additional beds in the places that I mentioned, some of the OR rooms that they could, the surgical areas. But we know that this is going to be an issue, so we've been talking with partners who have other locations that we might be able to use. Whether they be sort of like conference center spaces, hotels, motels. We're actually working with the National Guard on the potential to do a mobile hospital. We're going to prepare for a worst case scenario because that could happen sooner rather than later. And so we're preparing for all of those scenarios, not just for the acute patients, but there may be people that are subacute, that don't need to be hospitalized, but need to be quarantined and isolated. And so we're preparing to display, for places for all of those folks. All right, so that's the last journalist that we had on our list, but I would now open it up to anyone else who has any additional calls, anyone else on the phone that didn't reach out to us, or any questions that you just thought of as we were doing this.
Dave, this is John Hewitt from WWJ. Can you hear me?
We can, John. How are you?
Doing well, thank you. Along the lines of what you just talked about, and appreciating in many respects school and probably don't know, can you be specific at all in regard to what potential buildings, hotels, etc. are under consideration, and what quote-unquote worst-case projections do you think you're looking at?
So the question was, what are those worst case projections in terms of numbers, and who exactly are we talking to? And I actually can't, John, I don't have more to share with you at this particular time. One of the things we did is we invited any businesses who have these type of facilities, any universities who have dorm rooms, for instance, to call us and get on our list, make it known to us that you are willing to use these spaces. So we're gathering that information now, and we're trying to make a determination based on what the needs are, where the locations are, and so all of that stuff is still being evaluated now. Worst case scenario, I don't know if I can answer that in terms of numbers. I'm going to answer it in terms of one word: Italy. Right now we're looking at Italy as the model of what happens when your healthcare system gets overwhelmed, and frankly we're learning a lot of lessons from there in China and South Korea and all the rest of them, and so not in terms of numbers, but just in terms of resources and orders, like our health order today. This is based on what we think are best practices that we're seeing in other places. So that's how I would answer that. Thanks, John.
Hi, this is Paul. I have a question.
Hi, Paul.
I'm a little concerned or a little confused. There was an article in Cranes last week saying that the employers were not legally allowed to take temperatures because of the false positive readings and also ADA issues. And now you're saying that we should be.
So again, this is a recommendation for, okay, so the question was, is that there was an article in Cranes that said employers are not allowed to take temperatures. This is a recommendation. We're trying to keep our employers and, employees as healthy as possible. Those that are continuing to work, if that is decided that does not work for your facility, again, that checklist that we're gonna put together is really a questionnaire, and that's, asking the employee these questions on a daily basis and them self-recording and kind of telling you what they're experiencing from the day. Again, it's in order, but this is a recommendation really just to keep your employees as healthy as possible.
This is Kim Russell from Channel 7 with clarification. As I'm trying to envision this happening, a lot of companies don't have someone who can be at the door screening each person that comes in. In my business, people come in at all different times and there's not really someone who's at the door greeting you. Is it something that could be checked since we're doing this social distancing from a distance with an employee saying, this is my temperature, I don't have this distance, and you give them an email or text as long as it's being done?
I think that would be a great way if that works for your facility and your company. That would work. If you can have somebody that's having that conversation, obviously that helps, but that's not necessary as long as you're asking those questions on a daily basis.
Thank you.
David, hey, Leanne,
Yeah.
Rodolsky again.
Yes, hi, Ken.
I'm confused. You said we have 106 hospitalized, but then I also hear a few minutes later that Beaumont is at near capacity. So how can 100 and some odd people put Beaumont over capacity when there's other hospitals in Oakland County?
Well, not all of their patients are COVID-19 patients, so or confirmed, yeah, and we're talking about confirmed cases, so that takes a while to get through the system as well. We know with all of the numbers that we report to you, these are dated numbers. These are people who got infected a week or 10 days ago. And so it has to go through the confirmation process, but so those are confirmed numbers, but the real-time numbers are what the people at the hospitals are telling us.
And how many people are hospitalized again in Oakland County because of COVID-19?
100 reported cases. If you called every hospital in Oakland County and asked them, you would get a higher number. But these are the cases that have been reported to the health department, back to the state, and then released publicly, and there's a time delay in that.
Thank you.
Yep.
Hi, Darcy Moran with the Free Press here again. So these orders seem to put police in position of responding to possible violations. What's being done for concerns of their health safety in responding to these?
First responders are by the way, the question is what are we doing about the police who are being asked to investigate these situations and go into these public spaces. I would just say to you that we categorize first responders right along with healthcare workers in the priority group of people that we are trying to get masks for, PPEs, and other kinds of protection, get tested first. There's a priority for healthcare workers and first responders to get tested, for instance. So we are prioritizing the health and safety of our first responders and our health professionals because we know that they are on the front lines and they are the most likely to be exposed. They can't stop working, and so they are the prioritization for all of those things that I mentioned.
This is Tracy Hamilton with Michigan Radio.
Yes,
Do
Tracy.
you consider Joanne's Fabric or Hobby Lobby to be essential?
I would say no if I was on the hotline, but I would say call the number that we gave you because, heck, they could make an argument that they have N95 materials that you could make masks out of. If that's the case, we're not trying to close people down that have essential products and services. But in general, those are the kinds of stores that would be affected by this order. Any other questions? Yeah.
Yeah, this is Deborah Detroit News and Flash. So what does the county expect workers with symptoms to do? You know, go home, but for how many days?
Leanne can answer that. The question is, what does the county expect an employee to do that has symptoms?
Yeah, so if an employee has symptoms and they're sent home, we would ask that they are not cleared until they have 3 days fever-free with no fever-reducing medications and 7 days from the first day of onset. So that would be when they would be allowed back at work.
Other questions?
I have a question.
Yeah.
Are you offering hazard pay for Oakland County employees?
The question is, are we offering hazard pay for Oakland County employees? And the short answer is we are, and we're working through that with our HR department and our employee groups. So I don't have the details of that, but the broad answer is that for those employees who must come in and work in these high hazardous jobs, that there will be additional pay.
Okay, thank you.
Mm-hmm. All right. Anybody else? Well, I want to thank you for helping make our first Facebook Live press conference a reasonable success. We'll get better at this as we move forward, mostly by repeating the question. So thank you all very much for joining us, and stay safe, everybody.